periodically, he pushed a Q-tip right through the eardrum. We see this too.
Oh, God.
People with pencils, bobby pins. I thought no one knew what bobby pins were anymore. People still come in saying, oh, I use a bobby pin to itch my ear. Or, do you know what a bobby pin is, Alec? This is my son, Alec. Do you know what a bobby pin is? It's funny, I tell the kids, and we talk about paper straws and plastic straws. This generation, they don't know what paper straws are. They only know the McDonald's, those big plastic things. Whatever, we see people sticking pencils in, people sticking paper clips in, and again, that can lacerate. You're doing this blindly. You can lacerate the wall of your ear canal and create an infection. This is trying to bring home the point that swimmer's ear is the same thing as an external ear infection. If something scratches the side wall of the ear canal, water, which is not sterile, goes in here. That can cause this, and which is why they call it swimmer's ear, where the whole canal wall gets very swollen like this. We do see this, as I mentioned, where someone will stick a Q-tip right through. It's a decent distance in, but there are people who do this. Most of the time, fortunately, when they do, they don't damage anything except the eardrum, and it usually will repair itself within 5 weeks. Sometimes we have to go in and repair this, but you can imagine if there's a hole in the eardrum, take that drum head, you hit it with a stick, the sound wave is supposed to vibrate that eardrum. Well, if you cut a big enough hole in that head of the drum and you hit it, it's not going to amplify very well. So the larger the hole in the eardrum, the larger the hearing loss is created. Here's an eardrum. When we look in with an otoscope right at the ear, I mentioned that an eardrum kind of looks like wax paper. And you can see this is a normal looking eardrum. You can see a nice reflection of light. This, on the other side of the eardrum, is that first bone, the hammer, anvil, and stirrup. Here's that guy with the Q-tip. All right.
Oh, wow.
You can see, if you tried to hit that with a stick like a drum head, it wouldn't be as loud. This is another entity that we call it surfer's ear. We see these little bony growths in the ear canal, and they're correlated with swimming in a lot of cold water when you were a kid. We see a lot more of these on the West Coast because of all the surfing. It's like the bone just kind of heaps up these bony calluses. And you can imagine if sound had to conduct its way in, it couldn't really get all the way to the eardrum if these get very extensive, which sometimes they do. This is depicting that. Again, the goal is to get sound from here right to the eardrum. Here's another, it's just showing you that it is bone. Here's an idea. If we're looking in the ear canal, here's normal, we look all the way up to the eardrum. Here's mild, moderate. It can be very severe that the sound can't get through. Here's the normal eardrum. Here's a mild exostosis, as we call it technically. You can see the more involved these get, the less chance the sound can get through to the eardrum. And then it can get very severe like this. When it gets like this, we have to take them to the operating room, make an incision, lift all the skin off this, and almost like a dental drill, just drill all these bones down, and then put the skin back down again so sound can get through. Ears like this are very easy to get external ear infections, because even water from the shower gets trapped on the other side. All right, that's the external ear. The sound then conducts by vibrating the eardrum, and it's got to vibrate through this space. Let's go back to our drum analogy. If you hit the drum, it's loud. If you filled the drum up with water, it wouldn't be as loud. Well, we know that this middle ear space on the other side of the eardrum has to be filled with air so that when the sound wave hits the eardrum, it's not like the drum filled with water. We talked about kids who get middle ear infections. Middle ear infections. What happens is there's a tube that we all know connects the nose to the ear, the eustachian tube. When you're on an airplane and you go like this, you force air up, you feel the eardrum pop. That tube is very important because it keeps this space open to the world. Any space in the body that's closed off is a setup for an infection. If you think about a pimple is a sweat gland with a duct that goes to the skin. If that duct clogs off, it pusses out. You get an infection. You can't have a closed space in the body. It's like an abscess. As kids, we knew how to get rid of it. You popped it, you got a scar, but we knew intuitively to open that closed space up. Well, we know that this space on the other side of the eardrum needs an opening so it doesn't keep getting infected. That opening is the eustachian tube that goes to the back of the nose. In little kids, that eustachian tube, I'm sorry this is reversed, but I didn't want the words to be backwards, but that eustachian tube that goes from the back of the nose to that middle ear space, in kids, it's just not mature enough yet. It's not the right size, and for that reason, frequently, that space on the other side of the eardrum is a closed-off space, which makes it a setup for infections. And when the middle ear gets infected, it fills up with fluid. That's what this is supposed to be showing. Initially it's pus, then it turns to the kind of fluid that's under a blister, and then if air gets back up here, that reabsorbs. until the kid gets another ear infection. And after they have 1 million ear infections, they send the patient to me and they say, what are we going to do with this kid? We keep putting them on antibiotics. How can we get rid of this recurrent ear infection? When we look at it, we say it's bacteria trapped in a closed space. It would be nice if we can make this tube work better. And sometimes by taking the adenoid out, which is a clump of tissue that sits in the back of the nose right here, sometimes that helps. You can't really rotor-rooter this tube open. They tried that for generations. They tried whale bones to dilate it, all this stuff. It just scarred the tube up. So then some guy came out with a clever idea in 1954, a guy named Armstrong. He said, why don't we, when we look into the ear, we see this far. Here's the eardrum. Here's a drum with fluid on the other side of it. Here's another captured picture with fluid on the other side. Why don't we look at that space, and to make it so it's not a closed-off space, make a little pinhole in the eardrum. Nature does that. Occasionally the middle ear gets so infected, it builds up so much pressure, it looks for the path of least resistance, which is the eardrum, ruptures the drum. I get called by this parent saying, my kid was in terrible pain as it was building up pressure. Now there's all this bloody drainage. And I say, is the pain gone? They come back to the phone and they say, yes. So it's the best thing that could have happened. The whole eardrum perforated. I hope it stays open, because now this won't be a closed space. That kid won't get ear infections anymore. Well, this gave this guy Armstrong a great idea. He said, why don't we put a little opening in the eardrum, and so that it doesn't close within a couple days, just like if you pierce an ear, you have to leave the earring in, we put a tube in. So when we talk about these tubes we put in the ear, the tube is not the magic, the pinhole is. And we're creating an opening for this space, saying, well, until this matures from the nose to the ear, we'll now have an opening here. And yes, that kid has to keep water out of the ear, because if it goes through the tube, the ear will infect. That tube keeps the ear from getting infected. This is what these tubes look like. But they're not really that big. They're this big. And they're all different varieties. This is like 4 of them. There are like 20, couple dozen of these things. But they're really small. And you can see the concept is just to make a hole and just to put one flange on one side and one on the other so it just doesn't fall in or out. The difference between this and an earring is the eardrum over time closes and it just extrudes the tube almost like a splinter growing out. So we follow these tubes 6 to 12 months and then we find them in the ear canal. And the hope is by then that the natural tube has matured and is working better. Okay, so that's what a tube looks like. Go ahead.
When my granddaughter was little, she had infections all the time and tubes in her ears all the time. And finally her daughter took her off of drinking milk, and it seemed to get a lot better. Would you say something about food and this?
Most of the time, it's environmental allergies that play a part. Not so much food. The lining of this eustachian tube, remember, this is the important tube that naturally keeps the space open. That's the same lining that lines your nose. Breathing in stuff that irritates the nose that you may be allergic to not only will make the nose stuffy, but can make the eustachian tube stuffy, in which case that makes it not work well. Now, where dairy products come in, it could have been one of two things. Either your grandkid finally outgrew it, and the doctor got a lot of credit, but really it was just time, because that happens, because the majority of these kids will outgrow it. Or dairy products tend to thicken things. You know, you think you eat yogurt, you have ice cream, you're always thirsty afterwards. It thickens all the saliva. So even after tonsillectomy, we say, well, they can drink milk if they want, but it may get really gummy back there, they get harder to swallow. Well, if that stuff is so thick, the mucus, that potentially could plug up the eustachian tube. And so that may be where the difference was. The feeling is it thickens the mucus, the dairy products. If you eliminate that, that might make it better. So it's not really an allergic saying, oh, don't drink milk because you're allergic, but maybe you're making the environment nicer by not having the mucus be as thick. Okay? And here's a tube when we look in the ear, that's what it looks like. I always use these bright green tubes so that anyone who looks in can see it. When I started in practice, you learn in practice of medicine, I used to use these white tubes. I thought it was great. And every so often a parent would come in and say, oh, the pediatrician said the tube is out. I didn't want to embarrass the pediatrician, it was still in, so I use these green tubes. So if someone can't see this tube, then I know there's something wrong. So here's, again, a cross-section, and here's what the tube looks like when it's in place.
I have a question.
Go ahead.
How many percent infection rate after you put the...
After we put the tube in, by and large, you keep water out of the ear so it doesn't go through that tiny little tube. Remember on the penny how small they are. That feeling you get when water goes in your ear and you feel it in a pool and you feel like your ear is drowned, that's when water hits the eardrum. Water would have to go that far to get through the tube. So it's very difficult for water to get through. If you keep water out of the ear, by and large, the ear should stay infection-free. Once in a great while, even with a tube in, if the nose gets infected enough, it'll come out everywhere. Kids will have it coming out of the corner of their eye. It'll go up into the ear. It'll come out of the tube. So every so often we see a kid who gets a rip-roaring nasal infection, and we see it draining out of the tube. But the tubes are good, but that's rare. Most of the time, you put the tube in, the infection stopped that day. We do the older kids and adults in the office. We have some adults who have this problem. We actually put these tubes, they're called PE tubes, or pressure equalizing tubes. They're equalizing the pressure on this side of the eardrum without here. There are a lot of people when they fly on planes have terrible pain in their ears when the plane comes down, because they try